Ready?
Yeah. Thought I would talk about cold colds and hot colds. In Chinese medicine, there's a set of opposites or complementary factors that we look at to see what's going on in the body. Those might be things like full and empty or dry and wet and hot and cold. Someone who has a hot cold might be running a fever, but they're going to be hot. Their cheeks are going to be red, and they're going to be throwing off the bedclothes. They're not going to be sweating very much, and other fluids are not going to be coming out of that person's body. They're overheating. Someone who has a cold might be running a fever too, but they're going to be the person who has the chills and is shaking and wants lots of clothes and lots of blankets on. They're going to have mucus coming out of their nose. It's going to be thin and watery or white mucus. All of the fluids are going to be coming out of their body in a very pronounced fashion. What do we do when we have a hot cold or a cold cold? Well, we treat it with the opposite. If we have a hot cold, we want to cool things off. This is when we might want to drink orange juice or vitamin C. If we have a cold, then we want to heat it up. We want to drink some miso soup or eat a baked sweet potato. Herbs that are cooling to cool down that hot cold would be things like mint. And herbs that are warming to heat up a cold would be things like ginger. Echinacea is considered to be neither hot or cold, so it can be used with any kind of cold at all.
This has been Susun Weed and granddaughter Monica Jean talking about colds, hot colds and cold colds.